Hi, I'm Dr. Mike Bauer, and I'd like to talk to you a little bit about canine arthritis. This is Toby. He's 15. We adopted him a year and a half ago, and he came to us with severe arthritis in both of his knees. And he has chronic ACL tears in both knees, and he has chronic patella luxations. His kneecaps have never seen the right spot in his knee, and so consequently he's developed horrible arthritis, and we love him dearly. And so from both a personal and professional perspective, I'm very interested in the topic of arthritis because I live with it with Toby every day. So I'm going to share my thoughts about arthritis in general with you, the underlying causes, how it develops, how we diagnose it, and then try to bring some honesty to what our treatment options really are. And so that's what we're going to do. So I'll put Toby down and start. Okay, little man. There he goes. So first of all, on definitions. The word arthritis is broken down into arth and itis, and arth means joint and itis means inflammation. So arthritis is inflammation of the joint. It can be further broken down into inflammatory and non-inflammatory arthropathies, and as the names imply, it creates confusion. Inflammatory arthropathies are things like lupus, rheumatoid, or ehrlichiosis, an infectious disease. We do not see those commonly. What we commonly see are non-inflammatory arthropathies. Even though the joint's inflamed, we still call them non-inflammatory arthropathies, and that's the typical type of arthritis that humans have and that dogs have. There is one big difference between humans and dogs when we get into this non-inflammatory arthritis type of disease, and that is the difference between primary and secondary. Humans, because of many years of life and pounding our joints, we develop what's called primary arthritis. And so it's arthritis without an underlying cause. On the other hand, dogs almost never develop primary arthritis. They develop secondary arthritis, and it's almost always secondary to some type of joint pathology. And there's a lot of examples of what that is. For example, if a hip is put together poorly and rubs, we develop hip dysplasia or secondary osteoarthritis to that. If a dog tears their ACL, they have chronic inflammation from the tearing ACL and potentially joint instability and potentially meniscal tearing and rubbing against the cartilage, and they develop secondary arthritis, and it's secondary to the ACL tear. So that is a little bit of the difference between humans and dogs. And I'll just give you a really quick overview of when we say arthritis, a handful of things go on. The joint does indeed become inflamed. The lining of the joint, the synovium, becomes inflamed. They develop synovitis. Animals and humans will develop bone spurs in and around the joint associated with the chronic inflammation. The joint capsule thickens and becomes fibrotic, so we can't bend the joint as well, and dogs with ACL tears can't sit comfortably, for example. And then the kind of the end point of arthritis, and the part that we really don't have a great treatment for, although we wish we did, is when the cartilage starts wearing and will actually wear all the way through. So that's what we're talking about when we say arthritis. It's kind of a complex disorder that involves numerous parts of the joint. So with that in mind, let's talk a little bit about the causes of osteoarthritis. And again, in dogs, it's always a secondary problem, so we look for the underlying cause. And I've broken this down into some categories that make sense for me, and the first is joint incongruency. And so when a joint is put together poorly by Mother Nature and it rubs, the secondary result is cartilage wear and tear, joint inflammation, fibrosis, bone spur formation. and it's secondary to joint incongruency. Hip dysplasia is the perfect example of that. And I have a little illustration here of a series of x-rays and kind of how the hip joint changes over time. So let's take a look at that little illustration. This series of x-rays represents a young dog, say between 7 and 12 months of age, that is developing worse and worse hip dysplasia, where the femoral head or ball is gradually moving further and further out of the socket or acetabulum, and ultimately is completely luxated, where the ball is not within the acetabulum at all, and the development of bone spurs, as well as the socket completely filling in with bone. Okay, and then so those are a couple examples of joint incongruency based on congenitally that the joint is not put together well. Trauma would be another example. If an animal breaks their leg and the fracture goes into the joint and it's not repaired perfectly or near perfectly, those surfaces will rub and result in secondary arthritis. And then kind of in the same category would be joint surface defects. And an example of that would be a syndrome that we see in dogs called osteochondritis dissecans, or OCD, and it affects the shoulder, the elbow, the knee, and the ankle joint most commonly. And it's a defect within the joint where the cartilage actually doesn't attach to the underlying bone, and we have in some cases a very large void. And I've got a movie of that in a shoulder joint, and so let's look at that arthroscopic video of OCD in a shoulder joint resulting in a large defect. This is an arthroscopic video of a canine shoulder joint with a osteochondral defect. Osteochondritis dissecans is the disease. Okay, so those are some examples of where the joint is incongruent. Another common reason that dogs develop secondary arthritis is because of joint instability, and a very common cause of that are cranial cruciate ligament, also known as the anterior cruciate ligament. That's what most of us know it by, and so that's how we refer to it, as the anterior cruciate ligament, or ACL. So in dogs that tear their ACL, there's a lot that goes on. We'll talk about that further, but the joint oftentimes becomes unstable, and as it moves back and forth, we have all of those things we talked about a moment ago happen in the joint. And this illustration really shows some bone spurs that are forming along the periphery of the joint secondary to an ACL tear. So let's look at this next arthroscopic video. This is an arthroscopic video of a canine stifle joint, and what we're seeing here are large osteophytes, or bone spurs, that have formed. This particular patient has an anterior cruciate ligament tear, ACL tear, and that's what we see here. And the bone spurs that formed were secondary to the chronic inflammation. And here's a quick look at the medial meniscus, which looks good. Okay, so that's an ACL tear. Another example of joint instability is when part of the joint slides in and out, and we see that most commonly with kneecap luxations or patella luxations. And just the physical wear and tear can erode cartilage. And again, that's kind of the bad endpoint of arthritis, is when the cartilage wears away. So let's take a look at an arthroscopic video of a dog with a patella luxation. This is an arthroscopic video of a canine stifle joint with a medial patella luxation. And we see the patella, or the kneecap, at the top of the screen moving back and forth over the medial trochlear ridge. And you can see where the cartilage has been completely eroded away, and severe synovitis is present. And then another example of joint instability that can cause arthritis is trauma. So if a dog's hit by a car and they shear off one of their ligaments on their ankle joint that keeps their ankle joint stable, we try to replace that with an artificial ligament, but that unstable joint also can result in osteoarthritis. So those are some examples of joint instability causing osteoarthritis, but I'd also like to mention another that is chronic biomechanical wear and tear, and that's what we think probably goes on with dogs. Most dogs with ACL tears is that they tear a little bit at a time, and every time they tear some of the ACL fibers, the joint becomes inflamed, the synovium it turns very red, bad cells and enzymes are produced, osteophytes form, the joint becomes fibrotic, and in the end, cartilage starts to erode. So I have an arthroscopic video of a dog with an ACL tear that really illustrates this bad inflammation or synovitis that kind of starts all of this process. So let's look at that arthroscopic video. This is an arthroscopic video of a canine stifle joint with a torn ACL. And what we're seeing is severe synovitis or inflammation of the joint capsule surrounding the ACL. And this is one of the earlier phases of osteoarthritis secondary to the ACL tear. Okay, so those are some illustrations, both radiographically, x-ray wise, and arthroscopically of what we see happening in the joint. The other thing I've been alluding to is this fibrosis, where Mother Nature starts laying down scar tissue within the joint, and it minimizes joint movement. And that's we see that very commonly with ACL tears. And in fact, those patients are not comfortable bending their knees, or they physically cannot bend their knees, even under anesthesia. We can't bend their knees fully because they have so much fibrosis that's developed in the joint. And we have a little movie of a dog sitting down that has ACL tears on both sides, and you'll see that there's discomfort in bending the knees to get in a normal sit pattern. So let's take a look at that quick movie. This is a video of a canine patient that has an ACL tear. And dogs with ACL tears are reluctant to sit, and when they do, they take their time, they seem uncomfortable, and then they plop their legs to the side, and we call that failing the sit test. Okay, so those are some examples of how dogs develop secondary arthritis and the actual things that are happening in the joint. We've learned a lot about this process because of arthroscopy, and almost all board certified surgeons perform arthroscopy, so we're learning more and more. So that's the underlying causes, and now let's shift to how we're going to diagnose an animal that has arthritis, because it's thrown around as a very vague term. Oh, my dog has arthritis. In fact, I'll see patients that will come in and the owner will say, my dog has arthritis, and I'll say, okay, in what joint? And they'll say, I don't know, just generalized arthritis. And dogs don't get generalized arthritis. You know, they can get it in multiple joints if they have an underlying problem in multiple joints. So in the diagnosis, we use a number of modalities to try to figure out what joint it is and then what's the underlying cause. We certainly use clinical examination and feeling for thickening and lack of range of motion and discomfort on palpation and things like that. But we also do some additional tests. One thing that we do once in a while is do joint taps to analyze the joint fluid. That's not very helpful for the type of arthritis we're talking about here, but it helps us eliminate things like rheumatoid and lupus and those inflammatory arthropathies. So once in a while, but not commonly, we'll do joint taps. We commonly take x-rays or do radiography. And radiography is a really important part of diagnosing arthritis and the underlying cause. But the problem with arthritis is you cannot see the cartilage. So you do get to see bone spurs and inflammation of the bone, which it results in sclerosis. So it's called subchondral sclerosis. And in some joints, especially the knee joint, we can see fluid accumulating in the joint that tells us something's wrong. In some cases, we do MRIs, and MRIs, you can evaluate cartilage to some degree, and it's more precise than radiography, but it's also quite expensive, and the animal has to be under full general anesthesia to have an MRI. So we do MRIs, but not commonly. We feel like arthroscopy, which I'm getting to, is probably a better test, and that the MRI in some cases would be redundant and a redundant cost to the client. We feel the same way about computerized tomography or CT scans, or in our profession jokingly called CAT scans sometimes. They can be helpful, and we do use those some, but it again is fairly expensive and requires general anesthesia or heavy sedation at least. And many times we think it's a redundant test if we're going to look at the joint arthroscopically, but not always. So once in a while we do CT scans. The thing that we rely on most, and the thing that's helped us as a profession the most, is to look directly in the joint with an arthroscope. So I've got a really quick little video to show you what arthroscopy is. It's in the website. I won't insert it here because it'll take up a little bit of time, but you can look at that video on the website. It shows you how non-invasive it is and how we get to magnify the structures in the joint. We get to see those structures in their normal, natural anatomic position. So arthroscopy has been the greatest thing for both diagnosing arthritis, understanding what happens in arthritis, and of course, looking for the underlying cause of why the arthritis develops. So those are the main diagnostic modalities that we use in dogs that have arthritis. Now let's talk a little bit about treatment once we've kind of established that the patient has arthritis and hopefully we've identified the underlying cause. And that is where we are the most successful in treating arthritis, is correct the underlying cause. I mean, if that patient that we saw that the kneecap was sliding in and out, eroding the cartilage, we could give that dog every drug ever known to help treat arthritis, and nothing good would happen because the anatomy's still bad and it's rubbing the cartilage off. So in that case, we can really make that patient much more comfortable and probably clinically normal by surgically correcting that luxating patella. And treating the cartilage erosions without fixing the luxation part would be a waste of time and money. Okay, now that we've talked about diagnosis, let's move on to what most of us are interested in the most, which is treatment. And of course, I'm interested in that from a professional and from a personal point of view. And when it comes to treating canine arthritis, we're pretty good at treating the underlying cause if we can identify what that is. An example would be that patella luxation, where the patella is rubbed back and forth and essentially rubbed all of the cartilage off of the patella. We could inject that joint with every known product and administer every pill that's ever been known to help treat osteoarthritis, and it would be unsuccessful because of the underlying biomechanical anatomical problem. So we are best in treating the underlying problem. Another example in treatment is an ACL tear. So if an animal has an ACL tear and biomechanically the ligament is tearing and tearing and tearing, leading to synovitis, osteophyte formation, fibrosis, and cartilage degradation, we can treat that medically all we want with very limited success until we change the biomechanics of the joint. Fractures are another example that if we can line up the fracture well in a joint, we can minimize arthritis. Another example of how we can treat the underlying causes is with that condition called OCD. And in the shoulder joint, when they have OCD, just removing the flap arthroscopically is usually enough to result in successful outcome. But sometimes we'll make small holes in the defect to try to encourage influx of blood supply and resultant formation of fibrocartilage or scar cartilage. And I've got a little video of that, so let's look at that now. This is an arthroscopic video of a canine shoulder joint with a osteochondral defect. Osteochondritis dissecans is the disease, and that is the flap. It's also known as OCD. So here we've removed the flap, and we're left with a relatively large full thickness cartilage defect. So one of the procedures that's often utilized is to create small 1 millimeter holes into that bone in an attempt to increase blood supply, and the blood supply enhances fibrocartilage healing. Okay, so that's an example of a procedure called microfracturing. When we see OCD in the elbow and in the knee joint, we actually can fill that void with a graft, and we can take a little dowel of bone with cartilage on the edge of it and actually insert that into the defect and actually cover the defect with fairly normal cartilage. So that's another example of how we can treat osteoarthritis surgically. The final example, maybe not final, but one of the best things that we have going for us surgically is joint replacement, which is what we do when we get to the end stage of arthritis. And the hip joint is the main joint that we replace in veterinary medicine. We do 1 or 2 of those per week. It's very successful. We're not really treating the arthritis. We're actually taking the damaged cartilage, removing the osteophytes, and we're removing all the bad stuff and replacing it with just perfectly fitted, smooth titanium. So joint replacements are another way that we can treat patients that have osteoarthritis. Once we get past those surgical treatments, we're not as good at the treatment. I wish we were, and I recognize that every patient that has arthritis isn't a surgical case. Toby is the perfect example. Toby, I could do surgery to fix his ACLs, I could do surgery to fix his patellas, but because he has such horrible arthritis over a lifetime that has developed, that even if I correct his ACLs or patella, he's still going to have a very arthritic knee, and the gain from surgery isn't worth it. So I recognize that all cases aren't surgical candidates. When we get past the surgery side of things and start treating medically, we still have some things to offer, and new things are coming around all the time. But let me tell you that I wish there was something in a syringe or in a pill that I could give to Toby to improve his arthritis in his knee to the point that he would regrow cartilage and have a fairly normal joint. It doesn't exist, and it's not going to happen. I so wish it was. So we are limited in what we can do, but the general approach is first pain management. And the main thing that we use for pain management is an NSAID, a non-steroidal anti-inflammatory drug, and the one most commonly used in veterinary medicine is carprofen. There are others that are very effective as well. It's both a pain reliever and an anti-inflammatory drug. We think in the long run it may diminish the detrimental effects of the bad cells and the enzymes that are produced by that wicked synovitis that we saw before. And so NSAIDs are commonly used both for anti-inflammatory effect and pain meds. Word of caution, you can't use human NSAIDs in dogs. It can be fatal. Ibuprofen would be the most common example. It can create perforating gastric ulcers in dogs, so if you choose to use NSAIDs, see your veterinarian for an appropriate NSAID. We also use straight pain meds. Tramadol would be an example of what we use commonly in veterinary medicine. Then we kind of look at other drugs that aren't as clear-cut. One is steroids. We systemically use steroids occasionally for cases with osteoarthritis, but the detrimental effects probably outweigh its benefits, so that's not commonly used. Aspirin is, in my opinion, too commonly used. It's to get levels that are effective for pain management. I think in most cases can result in gastric ulceration, so I'm personally not a big fan in aspirin. And then we get into some of the nutraceuticals. Some form of glucosamine would by far be the most common. And I will tell you that in this diffuse osteoarthritis cartilage erosion patient, glucosamine will not regrow the cartilage. But we do see a lot of clinical patients improving on glucosamine. There's studies that show their pain scores or their lameness scores improve. We think that's probably an anti-inflammatory effect. Once we get past those types of oral meds, either pain, anti-inflammatory or some of the more holistic products like glucosamine. Then we get into things that we can inject in the joint. There's a plethora of things that we can inject in the joint. Steroids are one. They're very strongly anti-inflammatory, and we use those occasionally, but we hesitate to do the injection multiple times, so it has somewhat limiting effect. Hyaluronic acid is commonly injected into joints in humans, horses, and in dogs. It's abbreviated HA. It's a lubricant, and some studies suggest that it actually encourages the joint capsule to make more HA. So we're using HA with some success, but it's quite variable, not a panacea. As is the case for this next product that I'm going to mention, and it is platelet-rich plasma. And in platelet-rich plasma, we take a small blood sample from the patient, spin it down in a special tube and machine to get this layer of plasma that's full of platelets. It's also full of proteins that stimulate healing and block inflammation. It's been shown to be really effective, for example, in horses in tendon injuries. It's not quite so effective for generalized osteoarthritis, but we use it in some instances. Finally, on the list of things that we can inject in the joint are stem cells. And at CCO, we've done probably nearly 100 joints with stem cells. We're not huge fans. We've looked back in a lot of those joints, and there's no evidence of cartilage regrowth as we would expect. But a few of those patients, some of those patients, did clinically improve for variable lengths of time, and we think that's an anti-inflammatory effect. So we still do stem cells on occasion. There's two different types, one from the fat, one from bone marrow, at least clinically available to veterinary medicine. We're believers in the bone marrow stem cells that are cultured and then re-injected, but again, not a panacea and not going to regrow cartilage and not going to change the anatomy in the joint. So there's stem cells. So those are the things that we inject in the joint. There's a couple other treatment modalities that are questionable, but we use sometimes. We certainly don't think it causes any harm. And one is laser therapy. We have a lot of our clients say that their dog's more comfortable after laser therapy, but I have no hope that it is actually regrowing cartilage in the joint. Acupuncture is used by many as a pain relieving modality. I think that is good in some instances. And then we get into things that you can do at home and physical therapy. Exercise is good. Moderate exercise is good for osteoarthritis. Laying on the couch all day is bad, and chasing a ball thrown by a chucket for 6 hours is bad, but some level of activity is good for management of osteoarthritis. And then we have physical therapy or physical rehabilitation that's happening in veterinary medicine. And there's a number of modalities there. One that's used most commonly is an underwater treadmill. And it is looking like physical therapy is really helpful in making dogs with osteoarthritis live with it and live with it more comfortably. So there we have, some of the things that we can do at home or with a physical therapist to help with osteoarthritis. As you can see from this discussion, there is no panacea. We wish there was the magic syringe. It doesn't exist now, but hopefully it will someday in the future. But if you have a pet with osteoarthritis, we are best at treating the underlying cause, so I certainly would encourage you to see a board-certified surgeon to look for that underlying cause before you start indiscriminately treating a vague type of arthritis. If the patient would not be benefited by surgery, we have some things to offer, and new things are coming around all the time. So if you have a pet like I do that's living with osteoarthritis, good luck, and be hopeful, and we'll thank you very much for your time and listening to this presentation. Okay, bye.